Welcome to the training for site supervisors who are working with students in the clinical mental health program. We'll be talking about program expectations, requirements, and evaluation procedures. Okay, we'll start off talking about some CACREP standards related to fieldwork. All students in the program are required to maintain professional counseling liability insurance coverage. We have documentation of that. If you'd like them to provide you with a copy of this documentation, feel free to request that of your students, but we will maintain those records with the faculty supervisor. According to CACREP, supervision of practicum and internship students should include program-appropriate audio-video recordings and/or live supervision of students' interactions with clients. Obviously, they're going to get some opportunity to get audio-video recorded during their first semester fieldwork practicum in our clinic. Beyond that, when they're off-site, typically working with the good folks like you, sometimes it's more difficult to get these audio-video recordings. But they do need to at least get some live supervision. And if they're able to do audio-video recordings, that really is ideal in terms of audio-video recordings that then can be either evaluated by you or sent to the faculty to review, so the faculty can help determine how to assign an appropriate grade for their work. And if you have concerns regarding confidentiality and how we'll maintain that and maintain the integrity of any kind of recordings made on site, I'd be glad to talk with you about that. And we have some documentation regarding consent forms that clients you can possibly use with clients that explains why the recordings are made, how long they'll be kept, for what purpose they're being made, and clients' rights regarding the creation and destruction of those recordings. But that is certainly something that is helpful in evaluating students and giving them feedback to help them grow as counselors. Students need to be given both formative and summative evaluations of their counseling performance and ability to integrate and apply knowledge. We'll talk more about that in a bit. Students need to have the opportunity to become familiar with a variety of professional activities and resources, including technological resources, during their practicum and internship. So if you can provide a variety of activities at your site in a semester for a student, that's fantastic. If not, you're kind of like, well, we do this one thing and we do it really well. That's okay too, but it's incumbent upon the student then to seek out other activities, other experiences to supplement their training in order to get that variety. So again, if you're able to provide variety, fantastic. If not, that's okay. We do appreciate the quality work you do, and it's incumbent upon the student, again, to ensure that their experiences include a variety of professional activities. In addition to the development of individual counseling skills, during either the practicum or internship, students must lead or co-lead a counseling or psychoeducational group. So again, if at your site you're able to provide that experience, fantastic. If not, the student will need to make sure that they get that experience at some point during their fieldwork training. Okay, the CACREP standards related to supervisor qualifications. Site supervisors must have at minimum, a master's degree, preferably in counseling or related profession. So this might be marriage and family therapy, psychology, social work, relevant certifications and/or licenses. So this is typically LPC, LMFT, LP, LCSW. And again, I think the important focus here is on relevant certifications and/or licenses. So it depends on the work that you're doing and that students are doing with you. If a student is completing a field work experience in addiction counseling, then the appropriate certification or license for that may well be an LCDC. So whether or not your certification and/or license is appropriate depends on what you're training the student to do. If you have any questions about that, again, I'd be glad to talk to you about it. Also, the CACREP requires a minimum of 2 years of pertinent professional experience by the supervisor before they're able to provide supervision as a site supervisor. And they should have knowledge of the program's expectations, requirements, and evaluation procedures, which this video is attempting to provide you in part. Additionally, relevant training in counseling supervision. So those folks who have the extra level of certification licensure, LPCS, LMFTS, That's an easy way to document that you've had relevant training in counseling supervision. If you don't have that added letter, then we just need to make sure that we're able to document that you do have relevant training in counseling supervision, and we will be attempting to provide you with additional resources regarding training for those folks that are interested in such things. Okay. For CACREP, we also need to be sure that orientation, consultation, and professional development opportunities are provided by counselor education program faculty to site supervisors. So you'll be seeing more about that as those opportunities are made available, doing kind of continuing education things that could possibly be used for your own licensure needs. So some formal opportunities, and obviously informally consultation, always something that faculty are interested and to be available to do. Written supervision agreements that define the roles and responsibilities of the faculty supervisor, the site supervisor, and the student during practicum internship, and we have those. The student should be bringing that to you before they begin collecting hours, the supervision agreement that they should sign. They'll ask for your signature, and then the faculty will sign it after that. If you'd like a copy of that, just let the student know, and after they get all the signatures, they can bring you a copy. We'll maintain the original with the student record. And then when individual or triadic practicum supervision is conducted by a site supervisor in consultation with the faculty, then the supervisor agreement, there must be kind of another level to it, that details the format and frequency of consultation to monitor student learning. And we'll get to in a minute we'll get to the requirements regarding individual supervision. It's an hour a week, and basically it needs to be provided by the faculty unless it's provided by a site supervisor, where the site supervisor is in regular consultation with the faculty, because the faculty are ultimately responsible for assigning a grade and determining if the student is prepared to move on to the next stage of their training. And that's why we kind of need that, make sure we are documenting that we're providing that level of consultation. Oh, that's weird. Okay, in terms of the different classes involved in fieldwork, they start off in Practicum. That's their first semester of fieldwork. And the primary placement for Practicum is in our on-campus clinic, the Community Counseling Family Therapy Center, where they see clients from the community on a sliding scale fee. It's open right now, Monday through Thursday from 10 to 7, individual, family, group. There's several different groups that go on and see adolescents, kids, not super young ones, I think down to about 7 years old. But they'll be videotaped doing their work there, supervised directly by faculty. If they want to or need to, depending on the number of hours they can get in the clinic, they can apply to work at an external site during practicum. Many of them choose not to. They choose to just work in the clinic that first semester, and then after they kind of get their feet under them, they're ready to go out and work with you. Some of our students who may be a little more experienced, a little more confident in their skills, are interested in seeking those extra opportunities in practicum, and if we feel they're capable, they do have that opportunity. So, but after practicum, they'll complete internship. So most successfully complete practicum, and the internship is anywhere from 2 to 3 semesters, depending on how long it takes them to accrue the number of hours required to meet the program requirements and CACREP requirements. And some students will look to stay at a site the whole time of internship. Other students may choose to go someplace for a semester, get an experience, and say, okay, I've worked with these types of clients doing these things here. Now I'd like to go broaden my experience and work somewhere else. And I always tell students, your choice is often between breadth and depth. If you switch sites in internship, you're probably going to get a greater breadth of experience. If you stay in the same site, you're likely going to get a greater depth of experience because you're going to be more comfortable with the system. The site is going to trust you more, and you'll be given more responsibility and duties the longer you stay there. But that's something that I encourage students to talk about with their site supervisor early on regarding what's your expectations, what are my expectations regarding how long I may be working with clients at this site. And then the last thing here, students are responsible for procuring an external site. I often provide them with a list of places where students have been in the past and contact information, but ultimately it's up to them to reach out and make the contact and schedule interviews if that's what you're doing at your site. And then if you have any questions about students and you need to say, okay, is this a student you recommend? Okay, the CACREP standards that apply to Practicum tell you a little bit about what students will need to be doing. And again, for Practicum, many of them will be just in the clinic and not working with a site supervisor, working only with faculty supervisors, unless they get an external site, which is possible. Regardless, they need a minimum of 100 clock hours over a full academic term. That's a minimum of 10 weeks, which we have 16-week terms in the fall and spring, 10-week term in the summer. So of those 100 clock hours, at least 40 of those hours need to be direct service to clients providing counseling services. And again, because they only need 40 direct contact hours, that's one reason why many of them choose to stay just in the clinic that first semester. It's kind of a lower bar than what they're going to need for internship. If they are an external site, then it's not 40 hours at the clinic and 40 hours at external site. It's 40 hours direct total across the two sites. There's no minimum number of hours for a given site. Practicum students will have weekly interaction with supervisors that averages 1 hour per week of individual or triadic supervision. And this is typically provided by the faculty. So if they're in the clinic, there's a faculty supervisor who's assigned to work with them in the clinic. If they get an additional external site, then the site supervisor may be providing some individual supervision. So for Practicum, to meet this requirement of at least 1 hour a week of individual, the site supervisor can provide that as long as they are working in consultation on a regular schedule with the faculty member in accordance with the supervision agreement. And again, that's where we'll need to spell out, okay, you're going to get individual supervision from your site supervisor, and your site supervisor and your faculty are going to speak this often about these things, and everybody's kind of aware of what the expectations are. And then in addition to the individual supervision, students in Practicum are going to receive 1.5 hours a week of group supervision, and this will always be provided by the faculty supervisor on a regular schedule throughout the Practicum. So even if at the external site, they're going to need to be attending 1.5 hours pretty much every week with their faculty. So looking at internship, it's a little different. They need to complete 600 clock hours of supervised counseling experience overall, and this isn't in a given semester. This is over the course of all of their internship, which, as we said, is 2 to 3 semesters. 240 clock hours of direct service involving provision of counseling services. And so in a given semester, we've set an expectation of a minimum number of direct service hours that they will accrue to earn course credit. If they get the minimum, so in the long semester, it's 90, so 90 in the fall, 90 in the spring, and in the summer, it's 60. So if they get the minimum number of direct service hours each semester, it will take them 3 semesters to complete their internship requirements. If they can get, close to, on average, 120 each semester, then they can finish in 2 semesters. And that would be the more typical, the expectation is to finish in 2 semesters. However, for those students who are completing one of their internship semesters in the summer, because it is a shorter semester, sometimes they're not able to get quite that many hours. And so they may need that 3rd semester to finish out and meet their requirement. Okay, so on internship, they'll have weekly interaction with supervisors that averages 1 hour a week of individual and or triadic supervision. So again, in Practicum, this is typically done by the faculty because they're typically just in the clinic. Now, in internship, they're an external site. And so they still need 1 hour every week, on average, of individual or triadic. And again, triadic being 2 students with 1 supervisor. so 3 people in the room. What is in our supervision agreements, what we're asking folks to do is, if a site supervisor is able to provide all of their supervision as individual triadic, excellent, then we meet this criteria quite easily. Sometimes site supervisors have multiple supervisees, and it's not realistic for them to provide individual or triadic supervision every single week. And so what we ask is that they then go to an every other week schedule, where every other week they'll do individual triadic, and in the off weeks they provide an hour of group supervision, because again the expectation is an hour a week of some type of supervision is being provided by site supervisors. And so when that happens, for students to still get their hour a week of individual triadic, the faculty are being asked to come up to that, meet that other 50%, and meet those other hours of individual triadic supervision. And that's because the faculty are also expected to give them an hour and a half a week of group supervision on a regular schedule throughout the internship. And so regardless of how much individual supervision a faculty member is providing to these students on internship, regardless of how much that is, they still need to provide every student an hour and a half a week of group supervision. And again, regardless of how much group supervision they may be getting at site, there's basically this class where the faculty is going to see all of them hour and a half every week. One other just kind of thought on meeting this requirement. Again, it's weekly interaction that averages an hour a week or an hour and a half a week, but in case of individual supervision, that doesn't necessarily need to be an hour at a time. If you have a site where you could maybe be observing a student live for 20 minutes here, and then you go see this student, and then you'll circle back to that other student later in the week for another 30 minutes, and then 10 minutes here. Okay, well that's adding up to an hour a week of individual supervision. So there's nothing that says it has to be done in a set time frame other than averaging out to an hour a week. In terms of evaluating supervisees' clinical skills and dispositions. So this is something that's done at midterm and at end of term. And the tool we're currently using is the Counselor Competency Scale Revised that was developed by Dr. Glenn Lambie. And it assesses counseling skills and therapeutic conditions, as well as counseling dispositions and behaviors. And for each one of these things, it's kind of basically a rubric where for each skill or disposition or therapeutic condition, you're going to rate the student's performance where they're at. From 1, okay, what they're doing, how they're acting is harmful to clients, up to 5, they're exceeding my expectations. And so this is one reason I think it's so important early in the semester to communicate to students what your expectations are. That way, whenever you're rating them, it's clear that, okay, yes, I told you what you need to do, you're doing it, so you are meeting my expectations, or, wow, you're beyond where I expect somebody to be at this level of training, you're exceeding my expectations. So the tool that we use, it's a form that we'll make available to you. Whenever you evaluate them, obviously you'll sign it. Have the students sign a copy. Have them make a copy for themselves, or you can make a copy for them. And then depending on where we're at with our assessment plan, we may be asking you to also additionally enter the scores for your students, how you evaluated them, into Qualtrics, into a survey to help us track for the program at large how everyone is doing, and what percentage of students are meeting or exceeding expectations, and in what areas. Here's a little look at the tool developed by Dr. Lambie. The first part being skills and therapeutic conditions. So your typical stuff, their nonverbals, eye contact, their use of encouragers, the use of questions if they're appropriate, more open-ended than closed-ended. If they're using questions for an appropriate purpose. When they're doing reflecting, are they doing paraphrasing of content? Are they reflecting feeling? That's one I really push. At some point, are they doing some reflecting where they're summarizing kind of multiple aspects of content? And when you're looking at these things, again, depending on your setting, there are some skills that may be more relevant than others if you're talking about individual versus group. And so if you haven't had a chance to observe a student engaging in a skill, then you can simply mark it as not applicable it's not applicable for this setting. but they tend to be pretty broad and general things that you expect to see these things if they're providing counseling services. They should be doing this at some point. It goes on to advanced reflection of meaning, where they're kind of addressing kind of clients' core beliefs and values, reflecting that back to them. Confrontation, where they're challenging clients to recognize whenever either what they say is inconsistent or their affective presentation is inconsistent with the content of what they're saying, or what they're saying they want to do is inconsistent with how they're going about their life, those types of things. Goal setting and that collaborative goal setting that should occur early on and kind of throughout the process. Whether they're able to maintain a focus of counseling or if they're just chatting. And then facilitating the therapeutic environment, that empathy and caring and being respectful and compassionate toward their clients, which kind of starts to bridge over into dispositions a bit. But then the dispositions are the more kind of even broader things. Are they adhering to ethical guidelines, acting like a professional, respecting boundaries, both professional and personal? For your site in particular, do they have knowledge of and are they adhering to the policies that you specify? So are they following the rules that you set for your site? Are they doing the record keeping that you need them to do and accomplishing the tasks that you want them to do in a timely manner? In terms of multicultural competence, are they demonstrating respect for diverse people and the kind of knowledge, dispositions, attitudes, and skills that allow you to work competently with people that are different from themselves or that have issues relating to diversity or culture? And then getting more even personal about this particular counselor. Are they demonstrating emotional stability and self-control? Are they kind of self-aware that, okay, wow, I'm getting stressed out, I need to do some self-care, and are they able to do that in order to be a good professional? Are they motivated? Are they asking questions? And then openness to feedback. When you answer their questions, do you see a change in their behavior in response to the feedback being given? Do they demonstrate flexibility and adaptability? As we know, working with clients in several sites, things change. Okay, well, this is what we're doing today, but you know what? Here's this change in policy, or our clients have a shifting need. Can they adapt to those shifts? And then going back to kind of broad disposition, congruence and genuineness. Are they able to be fully present in their work and true to themselves? Again, this is about those kind of ideals we have of a competent counselor. Okay, in terms of the supervision documentation tasks. At the beginning of the semester, pretty much you just need to make sure that you agree with and then sign the supervision agreement that the student will provide to you. If you'd like a copy for yourself as well, just let the student know, and after they get all the requisite signatures, they can get you a completed copy. During the semester, you'll be providing them with written feedback at midterm, kind of a formal evaluation, to let them know where they're at, and then also any additional written feedback if needed. If there's areas of remediation, anything the student really needs to improve upon, I think it's best to document that in writing so they're not surprised at the end of the semester if they fail to remediate appropriately, that you're letting them know, hey, you're still not doing this. You've told them at least once earlier that they needed to improve in a particular area. The students should be bringing you their weekly hour logs to sign, that where they indicate how much time they spent delivering direct counseling services, as well as their indirect hours in terms of how much time they spent in supervision with you or preparing for clients, completing clinical documentation, those types of things. And I would ask that you kind of do a face validity check for any anomalies. Sometimes students will put a number in the wrong place. And if you noticed an unusually large number in a particular category, it says here you had 8 hours of individual counseling on this day. You don't do that much counseling here. I think you put a number in the wrong place. You gotta just check those things, because we will be relying on your verification of their time when we're later verifying how much time they spent for licensure. At the end of the semester, again, providing kind of written formal evaluation using the the counselor competency scale revised. We'll provide that form to you. We'll be rating them on all those categories, as well as providing some narrative feedback. And then the students should also be bringing you a summary sheet that summarizes their hours for your site for that semester. And they'll need a separate summary sheet for each site that they're collecting hours at. And they should sign it. You should, again, verify, make sure there aren't any anomalies. It matches whatever records you have regarding how they spent their time, and then sign it. And if you need a copy, let the students know. In terms of grading, assignment of the grade for a class, including fieldwork, is ultimately the responsibility of the faculty. However, most faculty spell out in their syllabus in what ways that grade is influenced by the evaluations completed by site supervisors. So please understand that your feedback is important in terms of determining what grade they get in a class and whether or not they pass a class. And that's usually factored in explicitly in the course syllabi of the faculty. For Practicum, they're going to earn a letter grade, and to advance to internship from Practicum, they need a minimum of a B or better. If they get a C, they'll be repeating Practicum before we release them to go off onto internship. For internship, it changes, it becomes pass-fail. And this is partly because faculty have less contact with them, because you as site supervisors often maintain kind of the primary responsibility. You're the one supervising their work. And so faculty still are responsible for assigning a grade. They have less to go on, but they still should be able to determine if a student is competent to advance or has demonstrated some areas of concern where they shouldn't advance. On that note, if any area of a final evaluation completed by a site supervisor or a faculty supervisor is scored as harmful, that kind of lowest category of 1, a couple things need to happen. One, make sure in that evaluation it should be documented, should be noted that whether or not that supervisor, whoever assigned that score, is recommending that the student advance to the next stage of training or not. Another student needs to either repeat this level or needs to consider other career options. Right? If applicable, it should be noted what remediation is needed. And again, this isn't the development of a formal remediation plan. Here's what you're going to do, but it certainly is information that will factor into the development of a remediation plan, because that's a separate process the department has to go through and the program goes through when needed. And it's super helpful to have those data from site supervisors if they have advice regarding what needs to be done for the student to get up to the level that they need to be at to work with clients. And then obviously document evidence of reasons for concern. So if you say, oh, this student is emotionally unstable, and there's no kind of explanation of why or what that means, it's really hard to hold students accountable without that being backed up with some documented evidence. And again, that's generally not an issue for us, but we want to be prepared for when it is, because we want to help students to remediate and get to the level they need to be so they can be effective counselors and go out and help people in the world. If you have any further questions, please feel free to contact me, Dr. Sam Fiala. I'm currently the Practicum Internship Director, or Dr. Jeremy Berry, who is the Program Coordinator for Clinical Mental Health Counseling. And thank you for all you do. Take care.